Hello, my name is Yuen, and this is Summer Session 2018 in Public Health 1, and my topic is diabetes type 1. Let's get started. Number 1, public health problem. Diabetes type 1 exists in the society. 10% of people who have diabetes have type 1. And the difference is that there are two types, type 1 and type 2. How the disease happens. When you have type 1 diabetes, your body attacks the cells in your pancreas that make insulin, so you can't produce any insulin. Your body breaks down carbohydrates and turns it into sugar. When the glucose enters the bloodstream, there is no insulin to allow it into your body's cells, so a buildup of glucose begins. Before diagnosis, the body tends to get rid of excess glucose through the kidneys, which increases the rate of urination and thirst. Where does this occur? Type 1 diabetes usually develops because of an autoimmune disorder, but no one can pinpoint where the disorder is caused. We can observe from the map that there are high rates of diabetes in type 1 in North America, Canada, Europe, and in Australia. What are its etiological factors? It is usually diagnosed around the age of 14 and is noted that certain genes are more common in one group of people than others, such as white people. If the father has diabetes type 1, then the child has a 1 out of 17 chance of getting it, and if the mother has it, the child has a 1 in 25 chance. Future risk for communities. People with diabetes have a higher risk of getting a skin condition such as infections around the nail, hair follicles, and eyelids. Eye complications include glaucoma, which is when pressure builds up in the eye, and cataracts, which is clouding of the eye lens. The nerves affect all parts of the body, and when there is damage, it can lead to numbness of the hands or legs or cause more serious problems such as urinary tract infections. Number 2, how to solve the problem. The first step in determining if you have diabetes type 1. If you have symptoms such as signs of constant thirst, fatigue, blurry vision, higher heart rate, etc., then you may have it. The doctor will probably do blood sugar tests, which may be random or fasting. Strategy 1, insulin administration. Injection of the long and rapid-acting insulin is usually required for insulin therapy. This substitutes the insulin that the patient cannot produce. Using a pump consists of a device with an attached tube that runs into your abdomen, so the insulin is pumped into the body. Strategy 2, maintaining a healthy lifestyle. It is important to center your diet on high-fiber foods, such as fruits, vegetables, and whole grains. It is important to discuss with the doctor about what type of aerobic exercise plan you may need. Physical activity benefits diabetic patients because it lowers blood sugar. Cultural and historical examples. Example 1, Finland study. From 1980 to 2011, 14,069 children were diagnosed with type 1 diabetes in Finland. There was a noted peak in 2006, but from 2006 to 2011, Finnish children younger than 15 years has ceased to increase their rate. Environmental factors such as the change in vitamin D intake may have contributed to the plateau. Example 2, China study. From 2010 to 2013, 5,018 people of all ages were diagnosed with diabetes type 1. 1,980 of those patients were over the age of 30. It is noted that those who lived in the northern parts of China had more incidences than those of the south. Researchers believe that environmental factors such as have a big influence, as they saw the contrast by latitude. 3. Public health in the future. What does literature say we do? In an article from the American Diabetes Association, it is encouraged that newborn babies should go through mandatory screenings and assessments in order to determine if children have the potential of getting diabetes type 1. By understanding how this disease forms, we can strategize how to prevent B cell destruction. Researchers continue to attempt to reconstruct or replace these cells with advanced technology. Overall, they conclude that with more experimentation and early data, they are getting closer to the solution to conquer diabetes type 1. My opinion. Overall, I agree with the current prevention plan. It is noted in the article that the community of researchers and scientists must collaborate in order to solve this case. It should not be withheld amongst other countries because this disorder is occurring everywhere. As I did my research, there is a lot of mixed opinions about diabetes type 1 that may be influenced by the environment and a person's lifestyle. In my opinion, everyone is affected by our environment. For example, it is not recommended to eat or drink certain things while being pregnant because it may damage the baby's health. In conclusion, I believe that researchers should continue their plan, but also focus on the adult's lifestyle before having a child. And these are my references. Thank you so much, and I hope everyone has a good day.